Thank you. My name is Dr. Kiragu. I am a gynecologist, and it's my great pleasure to share with you on this prevalent problem of infertility. First of all, I would like to state that it's very, very important to define infertility correctly. When is it that you say you have an infertility problem? Generally, we do not consider a couple to have an infertility problem unless they have made concerted effort to sire a child for 1 year or more. This is of critical importance because there are so many people seeking consultations and living with a lot of stress because they think they have a problem that does not exist. You need to have attempted to sire a child for at least a year before you determine that it's time to go and visit a clinician for assistance. Having said that, the inability to have a child, or what we call infertility, can be due to contributions by the male partner, but also can be due to factors affecting the woman, and sometimes both of them have a problem. So it is only by thorough investigations that you can be able to pin down on where the problem lies. Of course, when we talk about male infertility, it is common knowledge that factors like excessive alcohol intake, factors like excessive smoking are important modern day contributions to the infertility problem among males. Over and above that, there are men who are born with inability to generate or to make sperms in their testes. This is referred to as primary infertility of the man. This is somebody who has got total inability to make sperm from the point of birth. Then you have people who acquire infertility, men who acquire the infertility problem in the course of time. And the common contributors to this acquired infertility in men include, for instance, sexually transmitted diseases. The commonest known to the public might be gonorrhea and similar infections. Sometimes when you treated for cancer, which these days is rampant, the medications we use and some of the treatment modalities can lead to male infertility. Some of the diseases that we acquire in childhood, particularly mumps, mumps can lead to permanent infertility in later years by affecting the testicles of the male child. So these are some of the common reasons why males can become infertile. I would like also to state that male infertility is as common and as important a contributor to infertility as the female contribution is. In terms of statistics, for those people who like numbers, we think up to 40% of all infertility is due to male contribution. So you can see it's a very important contributing factor. So after that, we now talk of female infertility. Just like for the male partner, there are ladies who are born with inability to conceive. These females normally have genetic disorders, and these genetic disorders led to lack of formation of some of the important reproductive organs. For example, you have females who don't have ovaries, although superficially they look like females, but they're not having ovaries that can produce eggs. Then more commonly, females get infertile due to sexually transmitted diseases that later lead to obstruction of the fallopian tubes. The tubes that are supposed to transfer eggs from the ovaries to the uterus. So sexually transmitted disease is actually thought to be the commonest cause of infertility, both for males and for females. There are ladies who are infertile because of failure to produce eggs in a consistent manner. And these women, you normally talk of irregular periods. That is how we normally suspect that they may not be producing eggs. Now, this is a correctable problem. You can be able to give them medical treatment and restore consistent production of eggs. There are situations where both male and female are affected by infertility. We believe that sometimes the sperms and the mucus within the cervix may not be compatible, and that can lead to inability of the couple to desire a child. But not all the causes of infertility are known. Having exhausted all investigations, you still have about 10% of couples who are infertile and cannot find the reasons why. We refer to this as a known cause of infertility. So in a nutshell, infertility can result from both male and female in equal contribution, and only thorough investigations and proper history taking, and of course examination and investigations, as we have said, can lead to proper diagnosis and management.
Okay, what should you do if you are infertile and you want a child?
Yeah, if you are infertile and satisfy the definition of infertility as I alluded to before, that you have consistently attempted to have a child for at least a year and it's not happening, then the next thing is to visit a clinician with the ability to investigate the problem. Generally, this is the work of doctors who are referred to as gynecologists, and I'm fortunate to be practicing in this particular field. What the doctor will do initially is to take their history pertaining to your sexual life and that of your partner. Just by way of example, if, for example, you are married in a polygamous household and your co-wives are all having kids, but you're not having kids yourself for quite some time, then most likely your male partner doesn't have a problem, and you're going to concentrate on investigating the female person in this particular instance. On the other hand, just by way of example again, if a man has married a lady who had kids in another relationship, but this man has never sired a child, in all probability he will be carrying the problem. So investigations will tend to initially dove on the possibility of him being the reason behind the infertility. Yeah, but of course you investigate these people with an open mind until you conclusively